I get a lot of questions on how being a labor and delivery nurse has affected my pregnancy or my preparation for birth. And I think it's affected me in a few ways, but number one is that it's just made me so excited to give birth. Birth is just like the most beautiful thing ever, and I am so excited to experience it. I am so excited to experience labor and all the discomforts. I just think it is the most empowering thing. Number one, it just makes me really, really excited. Number two, I think that being a labor and delivery nurse has eased a lot of fears about labor and delivery and complications. Yes, I am fully aware of everything that could go wrong, but the reality is social media already exposes women to these very scary complications, and I truly think women are aware of labor complications regardless of what field they work in. But for me, I think being a labor and delivery nurse brings comfort because I've been a part of those scenarios. I understand the process behind the scenarios, the interventions. Whereas someone coming in, they've heard of these scary complications. Okay, now it's happening to them and everything's chaotic. I can only imagine how scary and traumatic that is. Of course, we do our best to explain to patients in emergency situations what's happening, why we're doing what we're doing. But there's only so much you can truly absorb in that situation. So I do think it's very helpful that I've lived through these scenarios with other women. Jen Hamilton, who's a labor and delivery nurse, has one of my favorite lines on TikTok that she uses with her patients in scary scenarios. And it's, "I know you're scared, but I'm not." It's something that I've started using with my patients. I know this is very scary. I'm not scared. We're not scared. You're safe. I feel like I'm going in without a ton of fear. I will say the one thing that was very hard for me, especially in the second trimester, was seeing potential complications that can happen right before viability or right at the viability line. Those are hard regardless, but especially when you're pregnant and especially when you have a patient that's around the same gestation as you that's going through something really scary, it really hits home. Also being part of preterm deliveries where the baby's around the same gestation or around the same measurements as my babies is a very emotional and surreal moment. But overall, I think being a labor and delivery nurse has brought me a lot of peace and comfort and excitement for my birth.